So what I'd like to do is to kind of take you through what you might experience if you came into our office for a consult related to facial rejuvenation, or in other words, the patient who looks in the mirror and just decides that there's something about her face or his face that may be changing and not looking as youthful as it used to, and so you get the opportunity to come in and talk with us. So obviously the first thing you do is you pick up the phone and you call us, and you can ask questions and get information. There's a lot of information on our website that will prepare you for the consultation, but eventually you pick up the phone and you make an appointment. And so when you make that appointment, we're going to give you about a 45-minute time slot to come in and talk with me. We really feel like it takes that amount of time for you to really have an opportunity to come in, speak to my patient care coordinator, Liz, speak to my nurse, Renee, or my medical assistant, Christy, so that they can understand your medical history. We can make sure that you're a safe individual to have any sort of procedures done, get a feel for what your concerns are, and then you get an opportunity to meet with me, and we're going to spend a substantial amount of time listening to you. So once you get in the room and you've done the preliminary work with my patient care coordinator and one of my assistants, I'm going to enter the room, and basically what I'm going to do is ask you what your concerns are. I'm not going to walk in the room and look at your face and start, tearing down what I see in your face. That's not the way things work. You're the person who's important to us. You're the person who's experiencing some facial changes that are related to things. So in other words, if you're an individual that comes in and your concern is that your neck is sagging or that your jawline isn't as clean as it is, and that's what you want to rejuvenate, I'm not going to approach you and say, well, gosh, ma'am, yes, your neck is aging a little bit, but haven't you thought about doing your eyes too? That's not our concern. Our concern is really to meet your goals. Now, having said that, if you open the opportunity to ask me what other things I see, I may mention to you that perhaps your eyes could use some rejuvenation, but really we're going to focus the consultation on what your concerns are. So the first thing that happens is that I walk in the room and get to know you a little bit, and then I'm going to ask you what your concerns are. And you're going to be able to tell me what you've been seeing, and that's where we're going to focus our effort. And so related to that, we'll talk about things from Botox perhaps, to fillers such as Restylane or Juvederm or Radius, to surgical procedures. There's a broad range of things these days that can be used to help with rejuvenation, and so we get a broad range of people that come in, and there are many people that come in that would certainly benefit from a facelift, but they're really not interested in doing a facelift. They're really interested in trying to do procedures that can be done in the office, that have minimal downtime, so that they can rejuvenate their face without having to go to the operating room. And gratefully, there are many different levels of procedures that we can do, and we're happy to try and educate the patient about which of these procedures would be useful to help them rejuvenate their face, whether it be any of the minimally invasive procedures that can be done in the office, or whether it's going to the operating room and participating in a surgical procedure. We hope this has been informative and that you'll pick up the phone and give us a call. We'd love to see you.